Wake Forest School of Medicine, Department of Psychiatry has been here for some time. We're part of a full comprehensive academic health center, multidisciplinary. We've now recently purchased the High Point Health System. So we actually have a variety of systems throughout the full course of care.
It seems in the United States that most people who become addicted to narcotics are exposed to those drugs initially following a surgery, and then they take the drugs to manage the pain and the recovery of the surgery. So the short-term goal is to see if we can perform these procedures on people and minimize the use of these more dangerous drugs. So our goal is to begin treating surgical patients with different kinds of approaches that allow them to tolerate their pain with medicines that are less addictive or perhaps even more effective.
At the Department of Psychiatry at Wake Forest University, I am Director of Student Clerkship, meaning I'm working with third-year medical students when they come for rotation in psychiatry, and I'm their primary evaluator, teacher, and mentor. Being clerkship director and professor of university, it's a major honor which any of us can help to share our knowledge, our experience, our point of view of modern medicine to young enthusiastic medical students coming to become doctors. My role as a director of electroconvulsive treatment is to organize and evaluate and after that treat patient. ECT is a procedure which is done in an initial series for patients who never have ECT before. ECT, at least in my world and in my opinion, is very safe and good treatment which will help people to improve their mental health functioning when in a position that major depressive disorder is taking best of them.
So TMS, or transcranial magnetic stimulation, is FDA cleared for non-drug treatment of major depressive disorder. It stimulates key areas of the brain that are underactive in patients with depression. Patients physically appearing better. Family members were reporting their loved ones having more energy and just seeming brighter. Unlike ECT, you don't have to have any sedation. There's no seizure that's induced.
So when I arrived here, we are in one of the most significantly affected opioid epidemic. I've been very fortunate to work in an institution now that wants to have addiction medicine, a fellowship and a service. One of the things that makes Wake Forest School of Medicine such a great place to start a fellowship is we're often called NIDA South, and we have over 150 graduate students every year who are studying addiction in a basic science lab or a preclinical lab or in our population health sciences. So we have all these graduate students who really don't touch clinical care, and one of the focuses of our fellowship will be to provide research training for people coming in.
So I am a child and adolescent psychiatry fellow. We specialize in children from the age of generally 4 until 18. I'm a board certified general psychiatrist as well, so I also see people from 18 to 64. We focus on building skills in children so that they can have healthy life practices and coping skills so they can function well. We do work with children who deal with addiction and issues with substance abuse. We try to help them find ways to cope, help them find other ways to deal with whatever the underlying problem is. So for some children, they are depressed and they're using it to self-medicate. Sometimes they have ADHD, and when we have them come into our clinic, we fully evaluate them for whatever mental illness they may have. And if they are suffering from substance abuse problems, we then give them the appropriate treatment for that as well.
Psychiatry has been very effective at developing new educational approaches for training physicians to treat addictions and to think about pain management in new ways. Their interaction with surgery really helps us treat our patients better. So we're growing together, and I expect that as the psychiatry department advances its addiction medicine fellowship, that they'll be very active in helping me take care of my patients and help all of us treat our patients better. Today, in the world of opioid management and pain management, we really need to all work together to move people away from these types of medications. And at Wake Forest, we're working collaboratively, surgery, anesthesia, psychiatry, to develop strategies that will do that using safer medications and alternative approaches to pain management.
Well, I'm most proud of the fact that we provided in my 3.5 years here good, honest, and quality patient care for all the patients who come to Wake Forest.